Hello friends, welcome back. Today, we'll go step by step through the disease activity and prognosis scores that we commonly use in connective tissue diseases. I'll cover SLEDAI, EU-STAR, DAS28, and the myositis core set. Let's begin. SLEDAI. For lupus, the Systemic Lupus Erythematosus Disease Activity Index, or SLEDAI, is like a checklist. It covers features from the skin, joints, serositis, kidney, nervous system, blood counts, and even antibodies. Every item is either present or absent, and each carries a weight. When you add them up, the total score reflects the disease activity at that moment. A change of 4 points or more is considered meaningful. For example, if someone suddenly develops nephritis and rising anti-dsDNA, the SLEDAI score will jump, telling you this is active and potentially dangerous lupus. Why it matters? Because persistently high scores predict organ damage and guide us to intensify treatment. EU-STAR, for systemic sclerosis. Now let's move to systemic sclerosis. Here we use the EU-STAR activity index. It includes things like the modified Rodnan skin score, new digital ulcers, tendon friction rubs, elevated CRP, and lung involvement. If the EU-STAR score is above 2.5, we call it active disease. That means the patient is at risk of progression, especially interstitial lung disease or pulmonary hypertension. So this tool helps us identify early activity and treat before damage sets in. For rheumatoid arthritis and overlap, next is DAS28, the disease activity score for 28 joints. It combines tender joint count, swollen joint count, ESR or CRP, and the patient's own global score. The formula may look complicated, but online calculators make it quick. For example, if a patient has 10 tender joints, 6 swollen joints, ESR of 40, and a global score of 50, the DAS28 comes out around 5.7. That's high disease activity. Interpretation is simple. Less than 2.6 is remission, up to 3.2 is low, 3.2 to 5.1 is moderate, and above 5.1 is high. Why does this matter? Because in treat-to-target strategies, DAS28 guides when to escalate treatment, and good responses predict less joint damage. Myositis disease activity core set. Finally, let's talk about myositis. Here we use the core set measures developed by IMAX and ACR EULAR. It's not just one number, it's 6 domains: physician global, patient global, muscle strength, muscle enzymes, physical function, and extramuscular disease. Suppose a patient's muscle strength improves by 30%, CK drops by 40%, and physician global improves. This counts as at least moderate improvement. The total improvement score, or T, gives us thresholds. 20 means minimal, 40 means moderate, 60 or more means major improvement. This balanced view captures both muscle and systemic disease, helping us track real progress. Dr.Yogesh gives quick reference of the most useful points. Now friends, let's finish with a crisp summary. SLEDAI, change of 4 points, is clinically meaningful. EU-STAR, above 2.5 means active systemic sclerosis. DAS28, remission is under 2.6, high disease activity is above 5.1. Myositis TIS, 20 minimal, 40 moderate, 60 major improvement. These scores are not replacements for your clinical judgment, but they give us a structured, evidence-based way to guide treatment and prognosis. Thank you for listening. If you found this helpful, please like and subscribe for more updates on connective tissue diseases.